Welcome back. Well, if you wake up with a headache or you've got the joint pain or even a fever, well, many of us instinctively reach for that bottle of ibuprofen, right? Well, a new study says if you have hypertension, you may want to think twice. Well, here's Danny's discussion with Dr. Kohli.
Dr. Kohli, great to have you back in studio.
Thank you, Danny. It's great to be here.
Of course. Okay, so there's a new study that came out. This involves hypertension and it involves ibuprofen, something that a lot of us have in our drug cabinets, keep regularly and take regularly. But before we get into this new study, I want to ask you more about hypertension. Tell us what this is.
Hypertension, or high blood pressure, is the pressure inside our blood vessels, and it's actually called the silent killer because often our blood pressure can start to go up and we don't really feel it until it's extremely high. So it's really important for all of us as we get older, because the blood vessels go from being elastic like water balloons to becoming a little stiffer. We have a natural tendency to get hypertension. Sometimes our habits also cause us hypertension. So I'm talking about weekends, drinking excess alcohol, or going out to eat where we know there's a lot of sodium in the food. So it's usually a combination of, biological risk factors, aging, as well as some lifestyle habits that can lead to hypertension. But it's really important because it's one of the most common diagnoses in the United States, and it's very, very high when it comes to cardiovascular disease in terms of how much of a contribution it has.
Okay, so that means this new study is going to most likely affect a lot of people at home. Tell us about these findings.
As a cardiologist, I see patients with hypertension all the time, and they're usually taking these medications, these classes of medications that are the top medicines that we use for hypertension. But this study tells us that those medications combined with ibuprofen, which people take thinking that it's nothing to worry about, can actually be the perfect triple whammy that can cause permanent kidney damage.
Oh my goodness.
Yes, exactly. So I really want this to sound an alarm in everybody's head, whether you have hypertension or not, that ibuprofen, which is widely available over the counter, can raise your cardiovascular risk, can cause high blood pressure, can cause cardiac arrhythmias, can cause kidney damage when taken in high doses, and can cause arrhythmias. So I don't want people to reach for that Advil or that Motrin or what have you, just, I had a joint aches or I feel better when I'm taking it, because chronic use of these medications can really have a lot of negative effects.
Yeah, okay, I'm kind of freaking out because that's what I have in my medicine drawer at home. Okay, so what should we be taking or doing instead?
So generally for people with hypertension, those with kidney problems or high blood pressure, Tylenol is a better option.
Okay.
And even then, I don't want you just taking Tylenol just because, Some people say I take Tylenol PM for sleep. I'm like, why don't you just take the Benadryl component that makes you sleep rather than also taking the Tylenol? But it's a safer alternative for those with hypertension, especially those that are on multiple medications for hypertension, because the kidneys don't react in the same way to Tylenol as they do to ibuprofen.
Okay, that's really, really good to know. Can we talk about too, are there certain foods or certain habits that we can get into that could help too?
Very much so. And when I think about treating hypertension, Danny, it really has to be this holistic approach. We're talking about treating your behaviors, treating, the pathophysiology of the disease. So the medications work with the pathophysiology of the disease. But how much you fill up your tank with sodium, which is that big one, is really, really important. So if I told you that the number of milligrams of sodium you could have per day was less than 1,500, that would be surprising. Because most things that we eat have more sodium than that in one serving than the entire daily allowance. So one of the biggest things we can do is cut down the sodium, cut down the alcohol, limit it to 1 drink a day if you're a woman, 2 if you're a man. Get off the couch. So that exercise, what that does is it releases those really great chemicals that actually relax the blood vessels naturally, helps us lose weight, which also helps with the hypertension, helps treat sleep apnea, which can help with hypertension. And it's really so many beneficial effects, not just on our physical health, but also on mental health.
Okay, guys, it's that simple. Just check your medicine cabinets, maybe toss out that ibuprofen, go for Tylenol instead, and get off the couch too, guys, and check your diet, sodium. Thank you so much, Dr. Kohli.
My pleasure.
Follow Dr. Kohli on social media, and if you have a topic or you've got a question for Dr. Kohli, message us on Facebook, and that's Colorado and Company on 9 News. Your topic may just end up on the show.